This is a hypermature cataract and with a liquefied cortex. I'm just showing how I went about it. So after staining the capsule, the moment I puncture the capsule, you can see this, and it's expected this egress of fluid. I don't usually aspirate this. I just tamponade this with further injection of HPMC, and there you can see it, and continue with my rhexis, and usually this can be done. As long as the paracentesis doesn't leak, you can just safely continue your rhexis rather than going on aspirating this fluid and filling in visco. So here almost complete. There is a slight issue with visibility, but since you have stained the capsule, it's pretty easy. So once that's done, I remove this free cap, and there is no need to hydrodissect this nucleus. Now remember, this nucleus is mobile. So I take a very sharp chopper, as you can see in my left hand, and I plan to impale this nucleus and do the woodcutter's method of chopping, woodcutters or the quick chop, whatever. And I'm not exactly aiming to get free floating pieces. You already have a huge floating nucleus. If you get a fairly good enough chop, well and good. So you can see the nucleus is pretty hard. It's not a soft nucleus, but it is a choppable nucleus. So I'm going for the heminucleus part. That's done easily. It's still attached in the center, which is good. And planning to make 2 more segments. I'm not planning to make too many segments. And in these sort of nuclei, I do not make too many segments, because then you can't control them flying around. So here this has almost become free floating, so I immediately remove it. I don't allow it to stay in the bag as I usually would with other sorts of cataracts. So I'm targeting another one, and you can see it's very difficult to stabilize this nucleus. However, managing to do it. It's still attached, so I'm not too worried. Just rotating, and here comes the problem. See, it's almost tilting in my hands. So I just remove a little bit of it. I'm trying to now engage it and pull it out. I don't want it to disappear from view completely. And there I've impaled it again, and this time I will chop almost from the periphery. Still attached, I go for the other piece. Rotate it. I'm now targeting that central area where it is attached. So I got it. I will target one piece at a time. Do not try to separate these at this moment in time, because they will start flying around. Look at that, how it's flying around. So got that. Just trying to push this down. Shouldn't have done that so aggressively, but anyway. So now I target the piece on one side. This is stabilized well enough. Get it into my phaco probe, and there, that's done. So what can be extremely challenging, with a bit of planning, you can handle it pretty easily. So once that's done, now it's time to go for the cortex. Yes, the cortex can be a little bit difficult sometimes in these cases, because you're not too sure about the capsule, but this capsule seems to be holding up pretty well. Just trying to clean up those bits and pieces, some of the fibers. You don't want that migrating down post-operatively into the central area, so trying to clean as much as possible. Targeting that bit of small cells on the posterior capsule, but you can see that fibrotic area. You have to be very careful. Sometimes you try to be too aggressive in these cases, and that will just open up. So better left alone. I then under hydroimplantation and implanting this hydrophilic IOL directly into the bag. And these lenses are so flexible, so although it hasn't gone into the bag, it's very easy to manipulate them. It's not a big sweat. Just know where to engage, and there, it's done. Easy peasy. It's in the bag. I then put in my intracameral antibiotic, check my wounds, and close the show. Thank you so much for watching.